The interactive patient simulator is a medical tool for training and assessing trainees and doctors for clinical scenarios in emergency room environment. It involves assessing the patient's medical condition, performing some medical procedures for diagnostic purposes and finally making a differential diagnosis on the basis of which a report is generated. The report determines the accuracy of the assessment made and reflects the doctor's efforts. To get started with the simulation, choose either one of the 3 timer options available in the menu. Initiate the history-taking procedure by pressing the dialog button. Understand the patient's medical condition and clinical history with the help of the listed categories and their respective questions.
I don't usually take medication. I only take when I have these crises. No. I feel lots of difficulty in breathing. No.
The physical exam follows the Ips assessment method. Procedures such as airway observation, pulmonary auscultation, checking pupillary light reflex, abdominal percussion and much more can be performed to further determine the patient's symptoms. Assess the patient's vital signs via the monitoring function. A wide range of tests can be performed on the patient, such as lab tests, ECGs and imaging tests. Multiple tests can be viewed simultaneously, expanded for clarity and dragged anywhere on the screen for multitasking. They can be removed by pressing the close button on the respective screens. The call option can be used to shift the patient to the ICU. Utilize interventions such as high-flow mask and peripheral catheter to stabilize the patient. Medications can be administered to the patient if deemed necessary. The simulation will end once the timer has ended, and an ending message will be displayed. It can also be ended prematurely if the doctor completes the simulation before the timer ends. The report can be viewed once the simulation has been completed. It displays the doctor's performance in each category and the score obtained as a consequence of procedures performed.